Have you ever felt a sting so sharp from a casual comment or a missed text that it felt like a physical blow? A feeling disproportionate to the situation, leaving you reeling, perhaps even believing the worst. Or maybe you've witnessed someone close to you react with overwhelming sadness or anger to something that seemed, to you, quite minor. If so, you might be familiar with a concept gaining significant attention recently: rejection sensitivity. And for some, it manifests as something even more intense, known as rejection sensitive dysphoria. This isn't just about feeling a bit sad when you're turned down. It's about a profound, often overwhelming emotional reaction that can deeply impact daily life. Today, we're going to explore rejection sensitivity, what it is, why it feels so potent for some, and most importantly, practical ways to navigate its challenges. We'll strip away the jargon and look at this often misunderstood experience with empathy and evidence, helping us all understand ourselves and each other a little better. Let's begin by defining what we mean by rejection sensitivity. At its core, rejection sensitivity is a heightened predisposition to anxiously expect, readily perceive, and intensely react to rejection, whether that rejection is real or merely perceived. Imagine your emotional fire alarm is set incredibly low. Even a wisp of smoke can trigger a full-blown emergency. When this response is particularly intense, leading to overwhelming emotional pain, a feeling described as dysphoria, it's often referred to as rejection sensitive dysphoria, or RSD. This overwhelming pain can be triggered by seemingly benign comments, a lack of response, or even an emoji if it's not overtly positive. Individuals experiencing RSD might feel this pain viscerally, almost as a physical sensation, and quickly engage in catastrophic thinking, jumping straight to the worst-case scenario. The term rejection sensitive dysphoria was actually coined in the 1990s by American psychiatrist Dr. William Dodson, who initially observed these patterns predominantly in his patients with ADHD. He also noted its presence in other neurodivergent individuals, including those with autism, and in similar contexts. Dr. Paul Wender's earlier observations in the 1960s also hinted at emotional dysregulation in individuals with ADHD, a concept closely related to RSD. This isn't just a clinical term, it's something that resonates deeply with many. Dr. Dodson's work has been instrumental in bringing RSD into public discourse, particularly within ADHD communities, fostering a sense of shared experience and understanding. The term has gained significant popularity on social media, leading to widespread sharing of experiences and information, and major health platforms are now publishing articles explaining RSD, its symptoms, and coping mechanisms. It's a topic that truly hits home for a lot of people. So, what does this actually look like in day-to-day life? RSD is very often linked to emotional dysregulation, which is a difficulty in managing emotions. This can lead to feeling easily overwhelmed and uncomfortable, manifesting as sudden outbursts of anger, rage, extreme sadness, or severe anxiety. It's like having a car with an incredibly sensitive accelerator and brakes that don't always respond when you need them to. While strongly associated with attention deficit hyperactivity disorder, or ADHD, with experts suspecting a link to differences in brain structure affecting emotion regulation, RSD is also observed in individuals with autism and other neurodivergent conditions. Research indicates that rejection sensitivity can also be a significant factor in a higher risk of personality disorders, anxiety, depression, and loneliness. It really casts a wide net. To cope with this fear and pain of potential rejection, individuals with RSD may develop several behavioral patterns. You might see people-pleasing, constantly striving to avoid disapproval. Perfectionism can emerge, an intense drive for flawlessness to prevent any criticism. There's also avoidance, where someone might steer clear of situations where failure or rejection is even a possibility, like applying for a job or pursuing a new relationship. And unfortunately, this often leads to negative self-talk and low self-esteem, where neutral interactions are easily misinterpreted as negative, causing withdrawal from relationships. It's a vicious cycle that makes connection incredibly challenging. Given the profound impact of RSD, it's natural to wonder about solutions. While it's crucial to understand that there are no treatments specifically approved for RSD due to its lack of official diagnosis, several strategies are effectively employed to manage its symptoms and improve quality of life. Think of these as building your personal toolkit for emotional resilience. One powerful tool is therapy. Approaches such as cognitive behavioral therapy, or CBT, acceptance and commitment therapy, ACT, and dialectical behavior therapy, DBT, can be incredibly helpful. These therapies guide individuals in processing overwhelming feelings, challenging distorted thinking patterns, like mind reading, where you assume you know what others are thinking negatively, or catastrophizing, jumping to the worst possible conclusion, and ultimately building emotional resilience. They help you learn to observe your thoughts without getting swept away by them. Medication can also play a role. Sometimes off-label prescribing of medications for ADHD and related conditions, such as certain alpha-2 receptor agonists or even monoamine oxidase inhibitors, can help. These medications work by modulating neurotransmitter systems implicated in emotional regulation and response, thereby reducing the intensity of RSD symptoms. Many people describe these medications as providing a kind of emotional armor, dulling the sharp edge of those intense emotional responses. Beyond formal treatment, there are many practical coping strategies you can integrate into your daily life. Building a strong support network of understanding friends and family is invaluable. Practicing mindfulness and using guided meditations can help activate your body's relaxation responses, grounding you in the present moment. Developing self-esteem and, crucially, self-compassion, a concept significantly explored by researchers like Dr. Kristen Neff, teaches you to treat yourself with the same kindness you would offer a good friend. Simple yet effective techniques like using affirmations and journaling can help reframe negative thoughts. Learning to say no in low-stakes situations can be a powerful way to build resilience and set healthy boundaries. There are even specialized programs, like RSD Free, created by hypnopsychotherapist Jessica Summers, which specifically target nervous system regulation to help calm the body's alarm system. These are all steps that, over time, can help you regain a sense of control and peace. Now, it's important to acknowledge that the concept of rejection sensitive dysphoria is subject to significant discussion and debate within the broader medical and psychological communities. This isn't to diminish anyone's experience, but rather to understand the landscape of current research and clinical practice. Perhaps the most significant point is that RSD is not an officially recognized medical condition or diagnosis in major psychiatric manuals like the DSM-5 or the ICD. This means it lacks specific diagnostic criteria, which can make it challenging for clinicians to formally diagnose and treat specifically. Much of our current understanding and discussion about RSD stems from clinical observations, online communities, and anecdotal evidence, with limited peer-reviewed scientific research specifically on it as a distinct syndrome. Critics also question whether RSD is a truly unique phenomenon, or simply an intense manifestation of general rejection sensitivity or emotional dysregulation, both of which are scientifically recognized and researched concepts. Emotional dysregulation, for example, is often considered a more inclusive term that covers a broad range of difficulties in managing emotions. There's also debate about its specificity to ADHD. While strongly associated, many wonder if RSD is exclusive to it, or a broader phenomenon that can manifest in various mental health conditions, including autism, borderline personality disorder, trauma, and attachment issues. And finally, given its unofficial status, there are no specifically approved treatments for RSD. The effectiveness of current off-label medications and general psychotherapies, specifically for RSD symptoms, rather than for underlying conditions, remains an area of ongoing discussion and investigation. So, what does this mean for the future? The outlook for rejection sensitivity dysphoria hinges on further scientific investigation. The existing controversies regarding its official status, limited formal research, and debated specificity highlight a critical need for rigorous, peer-reviewed studies. This isn't about dismissing the very real pain people experience, but about refining our understanding. Future research will likely aim to validate RSD as a distinct syndrome, differentiate it more clearly from general rejection sensitivity and emotional dysregulation, establish clear diagnostic criteria if it is indeed distinct, and identify specifically effective, evidence-based treatments. This continued exploration is essential to clarify its role in mental health and ensure appropriate, tailored support for individuals experiencing its profound and often debilitating effects. The goal is always clearer understanding and more effective help. Regardless of the ongoing scientific discussions, the experience of intense emotional pain triggered by perceived rejection is incredibly real for millions of people. Understanding rejection sensitivity, whether general or dysphoric, is the first step towards self-compassion and seeking effective strategies. By recognizing these patterns, exploring therapeutic tools, considering medication where appropriate, and building robust coping mechanisms, individuals can begin to navigate the world with greater resilience. Remember, your feelings are valid, and with patience and the right support, relief and a path forward are always possible.